Hello, I am Retdem, your student nurse, and for this video, we will do a role play about the general assessment. But before anything else, let us know first what is all about general assessment. Now, general assessment is to gather relevant information of the client, patient's history, and general appearance to improve pain management goals and overall patient's health. Now let's begin. For the pre-introductory phase, first is to need to review the client's previous medical records if available so that we could have a better grasp of the patient's health. It enables us to see patterns and make more effective decisions on patients' individual health needs. The second one is we have to determine the scope of assessment needed, prepare all the necessary equipment. This could help us to objectively identify the needs and concerns of each patient, and it is critical to have all the necessary equipment on hand. This will help us to do the task correctly and ensure the patient's safety. And the third one is perform hand washing. Hand washing helps us to avoid a variety of illnesses and microorganisms. So now for the introductory phase, first greet the client politely and the client's companion if around.
Hi, good day. How are you?
Hello, I'm fine.
Okay, that's great.
Introduce self and verify the client's identity to clarify the identity of both nurse and the patient.
By the way, I'd like to introduce myself. I'm Kathleen Ronquillo, your student nurse. First and foremost, I'd like to double check some of your facts. So, what is your name?
My name is Christian Paul Ronquillo.
How old are you?
I'm 22 years old.
Where do you live?
I live in Barbu, Surigao del Sur.
What date is your birthday?
June 4, 2003.
Are you a married man?
Right now, I'm in a relationship.
What do you want me to call you?
You can address me as Paul.
Explain the purpose and objective of the interview, the type of questions to be asked, and the reasons for taking notes, to offer the patient a sense of what questions to ask and how will the interview will proceed.
First and foremost, I'd like to understand that I need you to know this in order to assist you today. I need to inquire some of your health, medical history, in particular. Is that okay with you?
Yes.
Okay. Your responses will be recorded so that we can provide you with the best possible treatment.
Okay.
Okay.
Next is we have to assess for any potential barriers to communication. Examples, age, language, ability to speak, literacy level, ability to hear, etc., so that we know how to speak with and address the patient.
Can you understand and hear properly?
Yes.
Okay, good.
Provided the clients the opportunity to clarify, ask, or raise concerns. Accepting and responding to concerns gives the patient assurance, since it keeps them informed and prevents misinterpretations and misconceptions.
Do you have any questions, clarifications, or any concern?
None so far.
Alright. I assure you that all of the information will be kept private and far away with any potential source of distraction during our conversation. Just relax and everything will be okay.
Well,
Okay, so let's get started. So how can I help you today?
I have an headache.
Okay, so when did your headache started?
3 days ago.
3 days ago. So can you point for me what area of your head does it hurt?
This portion here.
In the middle?
Yes, yes.
Okay. Okay, so is all that hurts in that area?
Yes.
Does it hurt anywhere else?
No.
Okay. If you were to describe the headache, how does it feel like? Is it like beginning or sharp?
The sharp one, the sharp one.
Okay, the sharp one. So if you're going to rate the pain from 1 to 10, 10 will be the highest and 1 will be the lowest. So what number you should pick?
8.
8.
Yes, 8.
So how long this headache does last?
Around 10 to 15 minutes.
Okay. So does your headache come and go, or is it kind of persistent?
It comes and goes.
Okay, so what are the events that trigger your headache? Like, what were you doing in that moment when it hurts?
Using gadgets.
Okay, using gadgets. So, may I just ask, how do you usually use your phone?
7 to 8 hours.
7 to 8 hours. Do you rest in between 7 to 8 hours?
Yes.
Okay. So, what makes your headache worse? Like, food, medication?
I guess too much using of gadgets.
Oh, okay. So, it's only that reason. So, do you try to alleviate the pain by resting or doing anything else?
By sleeping, I guess sleeping about an hour to ease the
To ease the pain?
yes, to
Okay,
ease
so
the pain.
you like to rest.
Yes.
Do you take any medications?
No.
So you just rest for it.
Yes.
So besides the headache, do you feel any other discomforts?
I guess nausea.
Nausea. Okay. Or do you feel runny nose?
No.
No. Okay. Do you have any cough?
No.
Okay. So do you have trouble sleeping?
No.
Okay. So when you have trouble sleeping, like what do you take or what do you do anything?
Usually, what I do is I want my background to be darkened or dark so that I may sleep with ease and comfort.
Okay. You try to drink water?
Yes, also.
Okay, so thank you very much. Okay, Paul, for the next part of the interview, I'd like you to ask some of your past history. Okay, is that all right?
Yes.
Okay. So as I develop, can you recall your childhood about your illnesses like chickenpox or mumps? Okay, so do you ask your parents before if you timely immunization or vaccine? Okay, so you didn't recall the immunization or the vaccine. Okay. Do you have any medications that you take every day?
No.
Okay. So do you take vitamin C?
Yes.
So have you ever had any serious injuries that needed you to the hospital or seek medical care?
No.
You haven't. That's good. So are you allergic to any foods or medications? So next one, I'm going to ask you some of the questions about your family history and any diseases that runs in your family. So is that okay?
Yes.
Okay. So do you have family member that any have diseases or illnesses?
No.
Okay. That's good. You don't have like diabetes in your to your closest.
No.
Okay. How about someone with asthma?
No.
Okay, that's good. Now, next one is for your personal history. So, how do you feel today?
Pretty fine, I guess.
Yes. So, do you feel any discomforts?
No.
May I know who you are living with?
I live with my family.
You live with your family. Do you have any problems or doing any activities?
I do aerobic exercises.
Okay. So, do you have problems sleeping at night? Okay. That's great. Do you eat regularly or doing exercise?
Yes, I eat 3 times a day and do exercises often.
Do you smoke?
Mhm.
Do you drink any alcohol?
Yes.
Okay, now next is for the social history. So, do you work or do you go to school?
I work in a therapy center.
Therapy center. Okay. So, may I know what your hobbies are?
Um, for now, my hobbies are gardening and planting.
That's great. So, do you play in online games like in mobile phones?
Yes.
Okay. So, may I know what your languages are?
Um, Filipino, English, and Tagalog.
Okay. So, are you in a relationship with someone?
Yes.
Okay. For the environmental history, I'm gonna ask you some questions. Is that okay?
Yes.
How about a water supply in your house? Is it okay? Is it clean?
Yes. It is safe.
Okay. So, how about electricity? Is it good?
Yes. Yes.
How about your transportation?
I do commute and sometimes I walk.
Okay. So now we're here in review system. So I'm going to inquire about your weight. This will be the final segment, okay, for the interview.
Okay.
I'm just going to clarify some few things if you missed anything or you need to be recorded. So how about your weight? Are you satisfied with your weight?
Yes.
Okay. No sudden weight loss.
No.
Okay, that's good. Do you have any skin problems like rashes or itchiness?
Not at all.
Okay. What about your eyes? Do you have clear vision?
Yes. Yes.
Okay, that's great. Okay, now we have for the review. Okay, your for the interview. So you've had a headache for almost 3 days now. That's right. The rate of your pain is around 8.
Yes.
So when you use your phone, you get a headache, and then you try your best to relieve the pain.
Yes. Yes.
So that concludes the interview for today. We will just call you for the next interview or for the other test. Okay? Thank you very much, Paul.
Thank you so much.